Hi, I'm Dr. Jeff Brown. Welcome to Brain Builders. Have you ever heard of cognitive behavioral therapy? Have you ever wondered if it might be helpful to your child? Much of the research that's been done on cognitive behavioral therapy has focused on work with adults. But what does the research say about its effectiveness with kids? Can CBT be useful to them? The answer is a resounding yes. Cognitive behavioral therapy, commonly referred to as CBT, is a carefully researched therapeutic approach which takes aim at patterns of thinking that affect emotion and behavior. As one perfect example of CBT's value, Dr. John March at Duke University has written extensively on the usefulness and effectiveness of using CBT to treat obsessive-compulsive disorder in children and adolescents. CBT can be helpful to kids and teens who experience a variety of psychological disorders, such as depressive and mood disorders, as well as anxiety disorders including OCD, panic attacks, social anxiety, or separation anxiety. CBT can also be useful in managing behaviors like picking, nail biting, or hair pulling, just to name a few unwanted habits. More great news is that CBT can be helpful in areas even if a psychiatric diagnosis isn't present. For example, cognitive behavioral strategies can be used to improve social interactions, develop athletic skills, or strengthen self-esteem, which are all terrific examples of how changing thinking can change emotions and behavior. So you may be asking, how do you know if CBT is the right fit for a particular kid? First, kids who are able to think abstractly are typically great candidates for CBT because they are able to challenge their own thoughts and make use of cognitive thinking and reasoning skills. Younger kids tend to be concrete thinkers, which means they may miss abstract ideas or nuances in communication. As kids' brains start to develop more around pre-adolescence, they transition from being concrete thinkers to formal thinkers. Formal thinkers are able to wrap their heads around abstract ideas and concepts and also have a stronger reasoning ability. Next, it's important to assess how invested a child may actually be in the process of change and to solidify and support that investment. It's not uncommon for CBT to include take-home assignments or small experiments so kids can try out in the real world what they learn about in a therapy session. Sometimes even for adults engaged in CBT, it can be helpful to have an incentive or reward for doing the homework assignments. If you'd like to read more about how cognitive behavioral psychology can be used to reach success, pick up or download a copy of The Winner's Brain: 8 Strategies Great Minds Use to Achieve Success, which I co-authored with cognitive neuroscientist Dr. Mark Finsky. I hope it will help you build a better brain.